Good morning, good afternoon, good evening to all our audience. Welcome to another segment of Patching Sisters. And please be sure to subscribe to our channel to get us far and wide, because you just never know whose life you're going to be changing when they watch this video. So my name is Julian Chung, and I am a presidential director of LifeWave. And today we're introducing you guys to our Doctor Practitioner series. And our first guest is Dr. Teri Daunter, affectionately known as Dr. Teri. So Dr. Teri, hi, how are you?
I'm great. How are you, Julian?
Thank you so much. We are so amazing. And thank you so much for, being our first guest to our Doctor Practitioner series. I mean, not only are you our first guest, we're very, very excited because you are absolutely amazing. Okay. Our team, Nikki and I, we just both love you so much. And what you have done for everybody else, even before you decide to join our team, our LifeWave Team Continuum. So tell us who you are and what you do and what interested you to join LifeWave.
I'm very happy to be here, and I'm very grateful, and I'm especially grateful to Nikki and to you because of all the support that you provide me and my doctors, as a matter of fact. And I am Dr. Teri Daunter, and I'm a clinical psychologist, and I've been in practice in psychology for 40 years, and I love psychology. And also I have a doctorate in quantum advanced medicine. And the combination of those two have really helped me to provide the best care I possibly can to my clients. And the whole focus of my health and healing in my practice in terms of quantum is really what drew me to LifeWave. And when I was introduced to LifeWave, I was introduced by a lady friend, and it's very common for the two of us to actually get together and over a chai for 2-3 hours in the afternoon and just chat and philosophize, and we healed the world. You know how we do, as gals. But this time she had her own agenda, and she brought the patches over and introduced me to them. And I very quickly said, I just can't do it. I just absolutely cannot take on one thing. I'm seeing 30 hours of patients directly, and 30 hours of direct patient care turns into 50 hours of work. And I had just launched a book that was going global, that took a lot of my time. And I was just very busy with many things. And that evening, I thought about it. And I had tears rolling down my cheeks, and I didn't think much about it. And that next morning, because I do wake up 4:30 every morning to meditate, tears started rolling down my cheeks again as I thought about the patches. And she left 5 patches with me to try. And tears rolled down my cheeks. And I asked them what those tears are about. And there was this big voice in my head that said to me, "But Teri, this is not one more thing. This is what you've been doing all your life. This is about quantum. These patches are quantum technologies, wireless communication systems. This is what you've been writing about since 1995. It's all about quantum physics." And then the tears started rolling even more. And by this time, truly, I was sobbing. And I was sobbing because I thought to myself, well, the inventor, and at that time I didn't know who the inventor was. I didn't know David Schmidt at all, had not even heard his name from my friend. I thought the inventor had to have known that we are not this physical carcass that's going to decompose. We are spiritual, subtle, vital being. And with the patches, he's actually treating our vital being, because there is no healing in the physical unless the vital part of our existence is first healed. We have to heal people from the inside out, not the outside in. And when we attempt to heal from the outside in, it's an incomplete equation, totally incomplete, because this physical carcass is the lowest collapse of consciousness, and consciousness is the ground of being. There is nothing but consciousness. So we have to heal the part of our being that's the closest to that conscious and the vital, subtle part of our body. The light being, that's what we are. We are light beings healing light, or light patches healing light beings. That's what we are. And that's why those tears were rolling down my cheeks, because I realized that this man who invented these patches was truly an emissary of consciousness, truly an emissary of consciousness. He was an agent of consciousness being sent down to us to do this work. And then, you know, I wept some more. And it still brings tears to my eyes as I think about it now. I wept because I thought, if I had these patches a year and a half ago, I might not have buried 2 sisters and a brother in a 2.5-month period. In a 2.5-month period. And I want to mention this to your audience far and wide. Stay away from the drug Prolia, because that's the drug that took the life of my eldest sister, Maria. She had some pain in her neck, and the doctor gave her a shot. And when you put a shot in your body, you cannot take it out. It isn't like a supplement where you can just stop the administration of a supplement or a drug. It's permanent. It's in your bloodstream. That's it. You can't get it out. And within 3 weeks, her heart collapsed, her lungs collapsed, and she became a quadriplegic, and she was dead within 10 weeks. That's right. She was dead within 10 weeks, filled with edema. She was totally disfigured. So don't put anything in your body that you don't have to. And the patches, what caught my attention is they're non-transdermal patches with an electrodermal response in the body for the duration of the time that you have the patch on through infrared light. There is nothing on planet Earth that matches these patches. And I'm not easily impressed. I've been in practice 40 years. I've seen a lot of life. And you can't impress me very easily. I'm beyond impressed with these patches because they're non-transdermal, which means nothing goes into our bloodstream. Nothing. What they do is they stimulate the infrared light in our system, reflected back into our body. That stimulates the copper peptide, which is ubiquitous within our system. And that copper peptide, GHKCU, that copper peptide then stimulates the stem cells. And what are stem cells? You know, everybody has heard the word stem cell these days, but very few people really realize what they are. And they're like the roots of a tree. And if the roots of a tree are rotted or lost or weakened, there's not a whole heck of a lot that you can do with the leaves or the branches. That tree is going to die. And we know that for every year that we are on planet Earth, we're going to lose 1% of our stem cells. So by the time you get to be 50 and 60, you're in what I call a vertical illness. You're really a walking dead because the majority of your roots, your stem cells, are gone. What the patches do, especially the X39, is stimulate and duplicate, because we know that stem cells are pluripotential and multipotential. We can duplicate them. And that's what those stem cells do, is duplicate. And then they heal the tissues and they heal the organs. And from then on, anything is possible. This whole area of regenerative medicine is so exciting because we know we can regenerate our body. We know we can do that. We know. So it's very exciting. That's how I got involved, and that's why I'm still here, and that's why we'll continue to be here.
Wow, that is so amazing. I knew you were amazing, but I am so sorry about your sisters. I didn't know about your sisters. And I truly do understand what that means to you because, 10 years ago when I first found out about the patches, then Nikki introduced it to me in, 2012. My mom had just passed away in December, and Nikki introduced it to me in February, March. So I do truly understand how that feeling of what if,
What if?
I wish I could have, but at the same time, I use that feeling of longing to have helped my mom, and I use that to help others, other parents especially, and children. So those two are the population that my heart reaches out to. So I totally do, truly do understand.
Yeah, it turbocharges you.
It does. It does.
To make sure that you tell the world they have options besides toxic medications.
Mm-hmm.
That's true.
Yeah. But I also know that you have your own personal experience when you first got the patches and started using it for yourself. So can you tell us, share with us some of your personal experience?
Absolutely. The first time that I used the X39, within 20 minutes, my eyes went up. It's like someone turned on the lights. And when I talk about my eyes, it's very significant to me because 10 years ago, I had been diagnosed with Graves' disease. And Graves' disease is very grave. It almost took my life twice. And I could not really get any help from Western medicine with what I was going through at that time, literally, because my body is very ultra sensitive and I could not take medications. And so when I talk about my eyes having a dramatic improvement within 20 minutes, that was very significant because Graves' disease left me with double vision and a lazy eye combined. And that has gone away. And you're seeing me with glasses, but I'm wearing glasses very little any longer. And I've been wearing glasses since 10th grade. And, that's many moons ago for me. But I'm wearing glasses about 20% of the time. And this past week, actually, I had an eye exam and he says, oh my goodness, your myopia has improved dramatically, which means that I can see at a distance so much better. And my eye pressure, which tends to really get elevated with Graves' disease, is 15/15, which is extraordinary because it typically hovered around 19 and 20. So I had that specific experience plus, and this is really funny because when I used the X39 for the second day, it was in December, it was winter. So I had a list of things I wanted to accomplish in the winter months, a list of things. And I wore the X39 and I accomplished them all in one day with the energy to spare at the end of the day. And I literally had to get off the patch. So much energy. I literally did because I thought I was going to fly off of Mount Everest.
That's absolutely fantastic.
Sometimes we do feel that way, that we can fly.
Yeah, absolutely. So I just kind of slowed down a little bit on them. And the energy I feel, honestly and truly, I feel like I am in my 30s again with the energy. I had missed that because of the chunk of energy Graves had taken out of my life, you see. And, I can tell you one other thing that is really, really critical. During the pandemic, I was unable to continue to access the supplements I was taking to support my body from the thyroid issues, because I refused to be on medication. Okay. And even though I had a thyroid ablation, which means I had no thyroid. Okay. And I refused to be on medication because my attempt to be on it was literally killing every cell in my body. So I was having to flounder my way through this. And during the pandemic, I had found, before the pandemic, I had found a series of supplements that really supported me, and my thyroid was in the normal range and I felt great. But during the pandemic, the manufacturer could no longer get the product to continue the supplement. And I just kept trying this and that and the other. And you just don't do that with the thyroid. The thyroid needs consistency. And my TSH went up to 70, and it should be 2. Went up to 70, my TSH. What did I do? I did the yin yang detox and brought it within a month to 2.3.
Wow. That's
There you go.
amazing.
That is amazing.
It kind of works, doesn't it?
You know, it is really beyond, does it work? This is life-changing. It honestly is. This is truly, like I said in my email this morning, it is the difference that makes a difference. These are portable acupuncture, needleless acupuncture patches. And you can take them anywhere. You can take them anywhere. They are beyond remarkable, really, truly.
Yeah, I mean, speaking of taking it anywhere, we are in over 70 different countries. So yeah, you can literally take it and ship it to anywhere.
Yes.
Yeah, world is our oyster.
It is. Yes. But it's so portable. You know, it's small and it's portable. For 3 years, I've used pulsed electromagnetic frequency. I don't know how familiar you are with that, but I've done research with pulsed electromagnetic frequency on the use of PEMF to reduce and or eliminate opioids. And the results are absolutely remarkable. So I'm a real proponent of pulsed electromagnetic frequency. And the patch, to me, is similar to the PEMF, but the PEMF mat is a huge thing, and I was lug it around with me wherever I went, you know. And now there's this quarter-size patch that, to me, does the same thing because they regenerate your stem cells.
Okay, to show everybody what Dr. Daunter is talking about. Yeah. Oh, is that what you were doing, Nikki? You were bringing out the energy patch? Okay. So this is a pack of 30, guys. This is a pack of 30. So Nikki, can you show us what one looks like? That's how tiny it is. And then on top of that, it actually does stimulate up to 2-inch radius. And we could leave it on our body 12 to 16 hours. So it is like getting the therapy for 12 to 16 hours. And we have daytime and nighttime way of patching. So you can actually stimulate your body 24/7 to be on a continued healing mode.
Yep. But what I like the most about this business is there's a little package right here. This is my business. I don't have to carry this big, huge mat.
That's our business bag. Even at expos, our banners are bigger.
I've never seen that.
Oh, you better show it up, sis.
Oh, now does LifeWave sell that?
No, Nikki actually bought those. We went through a period where we're actually not looking for purses. We always look for different bags to carry our patches most effectively. I'll show you my business bag. It's a little bit bigger because I'm a little bit more prissier than Nikki is. So my bag does have to be a little bit bigger because I tend to carry more things. But yeah, this is my business bag.
Nice.
Yeah, it's about 12 inches wide, 10 inches high. And I think this is actually a makeup carry bag.
Nice, very nice.
Yeah,
I'm gonna have to start carrying a bag because I don't carry purses, so I'm gonna have to somehow find.
And you could throw your keys in there. There's plenty of room for your keys, you know.
You know, to get back to the patches and their benefits. What a lot of people often do not understand is that we are not slaves to our genes, and that our health is only 20% connected to our genes, and the other 80% is epigenetics. It's what happens beyond our genes, and that's influenced by our environment, external and internal. And this is where the patches shine at their very best, because they stimulate our own stem cells. And look, stem cell therapy is very real and it saves many lives, but it's also very expensive, $10,000 to $25,000 a treatment, and also very risky. It's very risky because, first of all, you don't know where your stem cells are, from where your stem cells are coming, and you don't know what kind of reactions you are having. But the LifeWave patches, especially the X39 and the X49, are stimulating your own stem cells. So there's no risk involved. They're just 100% safe, and they are supporting that 80% epigenetic component of our health, you know, which is just so important because they're working off our own internal environment. So, you know, diet and environmental pollution and all of those have such a remarkable effect on our body. And the LifeWave patches are remarkable. And I think both of you know my two favorites, right? The X39 and glutathione. Yeah, I really love the glutathione because it's such an incredible patch for cleaning out inflammation. And we know the inflammation is a marker for almost all diseases. So we really need to clean that out. And it is such a quick acting patch too, where it increases the glutathione in our body by up to 300% within a 24-hour period. You know what? There is nothing on planet Earth that can do that. Not even the IV that they give to cancer patients. And I know that that is true because I've asked oncologists in my community, and it cannot compare with the patch in terms of enhancing glutathione at that rate. So
that's so amazing.
And then my other favorite, I have a lot of favorites, but then the SP6, the SP6, I really, I believe that's the one that made such an incredible difference in bringing my TSH from 70 to that 2.3. The SP6 balances and intervenes in the HPA axis, the hypothalamus, pituitary, and adrenal simultaneously, and it brings it into balance. And then that, along with the Eon patch, you know, we're all on sympathetic overdrive. And by using the Eon patch, we take our system from sympathetic into the parasympathetic. It just doesn't get any better than these patches. And if you think I'm excited, you are right.
and all your excitement is just giving us goosebumps, you know, and we're excited with you. And Nikki and I, we've been doing this since 2012, but honestly, every time it could be just a little pain, you know, it could be just a little pain. And when we're able to help, you know, reduce it to the point of, you know, being zero, and it's not coming back for months and months at a time anymore. I mean, we get excited, and with the very, very, you know, limited knowledge that we have, honestly, with the patches, we know mostly it works, and we know how to patch for a lot of people. But honestly, there's over 90 clinical studies. I haven't read any of them. I don't know how it works. I just know that it works. All I know is that, you know, my phone, it just has to do what I need it to do. I don't need to know how the electricals and batteries and blah, 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 you know, does for this. You know what I mean? So do you have any final thoughts that you'd like to share with us?
I don't really at this particular point. It's just been such a pleasure to be with both of you, and know that I'm honestly, truly, eternally grateful for your continued unstinting and tenacious support of me and my group. Thank you very much. And I love you both very much.
It's been an absolute pleasure and will continue to be. So Thank you very
Thank
much,
you.
audience, for joining us today. And Nikki and I would love to, thank you everybody for being with us and listening to, Dr. Teri. And I hope you've learned a lot as much as we have. And if you are ready to get started, we're going to have Dr. Teri's information as well as Nikki's and my contact information in the description of this video. And if you like the content of our segment, please be sure to click and subscribe to our channel. And again, spread the word far and wide and have your friends and family subscribe and join us as well. And thank you so much again for joining us. And we will see you at the next one.
Bye now.